A healthy microbiome can help keep harmful germs like H. pylori in check. Some research even shows that consuming probiotics can be helpful alongside medical treatment for an H. pylori infection, potentially reducing side effects and improving success rates. Phone reminder: add 1 probiotic food to my day. There are also specific foods that contain powerful plant compounds called polyphenols that may offer extra protection. These compounds have antioxidant and anti-inflammatory properties. Foods bursting with color are often rich in them: blueberries, raspberries, cherries, red grapes, spinach, kale, olive oil. Some studies suggest that these compounds may help inhibit the growth of H. pylori and protect the stomach lining from damage. You do not need to seek out exotic superfoods. Simply aiming to eat the rainbow by including a variety of colorful fruits and vegetables in your diet is a brilliant strategy. Just as some foods can help, others can sometimes cause irritation, especially if you already have a sensitive stomach. Coffee, carbonated drinks, very spicy dishes, high-fat or fried foods. This is highly individual. The key is to be a detective for your own body. If you notice that your morning coffee consistently leads to a burning feeling in your stomach, our medicine cabinets can be a source of great relief, but they also require our careful attention, especially when it comes to stomach health. The most important rule is to be mindful of NSAIDs. As we've discussed, frequent use of ibuprofen, naproxen, aspirin is a leading cause of ulcers. If you only take an NSAID occasionally for a headache, the risk is low. The danger comes with regular, long-term use for chronic pain. If you need pain relief often, it is essential to have a conversation with your doctor. Ask them, is this the safest option for my stomach? There may be alternatives, such as acetaminophen, which is generally gentler on the stomach lining. If you and your doctor decide that you must continue taking an NSAID for a condition like arthritis, there are protective strategies you can use. First, always take the lowest effective dose for the shortest possible time. Never take more than the recommended amount. Second, always take your NSAID with food or a glass of milk. This can help buffer its effects and reduce direct irritation to your stomach lining. Do not just swallow it with a quick sip of water on an empty stomach. Taking this small, simple step every single time can make a significant difference in protecting your gut from harm. It is a non-negotiable habit for safe NSAID use. Phone reminder: take NSAIDs with food, always. In some cases, your doctor may recommend taking an additional medicine to protect your stomach while you are on NSAIDs. These medications are designed to reduce the amount of acid your stomach produces, giving your lining a better chance to stay healthy. Common options include proton pump inhibitors, such as omeprazole, or H2 blockers like famotidine. These are highly effective at preventing NSAID-induced ulcers. If you are over 60, have a history of ulcers, or are taking other medications like blood thinners, your doctor will likely discuss this protective approach with you. Never add these medications on your own. It should always be part of a plan you create with your healthcare provider. Finally, it is vital to be proactive about H. pylori testing, especially if you fall into a high-risk category. If you need to start long-term NSAID therapy, it can be a wise move for your doctor to test you for H. pylori first. If you have the infection, treating and eradicating it before you start the NSAIDs can dramatically lower your risk of developing an ulcer. The tests are simple and non-invasive, often involving a breath test or a stool sample. Being proactive in this way is a perfect example of modern preventive medicine. While self-care and prevention are incredibly powerful, it is just as important to know when to seek professional medical advice. Your doctor is your most valuable partner in managing your health. You should make an appointment to see them if you experience any persistent ulcer symptoms. Recurring burning stomach pain, frequent nausea, bloating, feeling full too quickly. Do not wait for the symptoms to become unbearable. An early consultation can lead to a simple diagnosis and effective treatment, preventing potential complications down the line. It is always better to get checked out and find that it is nothing serious than to ignore a problem that needs attention. When you see your doctor, they will listen to your symptoms and may recommend testing to get to the root of the problem. The primary goal will be to check for an H. pylori infection. This is often done with a simple breath test, where you drink a special liquid and then breathe into a bag. They might also ask for a stool sample to test for the bacteria. In some cases, a blood test may be used. If an ulcer is strongly suspected, or if your symptoms are severe, your doctor might refer you for an endoscopy. This involves passing a thin, flexible tube with a camera through your mouth to look directly at your stomach lining. If you are diagnosed with an H. pylori infection, the treatment is usually very straightforward and highly effective. It typically involves a combination of 2 antibiotics or 3 antibiotics. Alongside the antibiotics, you will also be prescribed a strong acid-reducing medication, like a PPI. This combination therapy kills the bacteria and lowers stomach acid so the ulcer can heal. It is crucial to take the full course of medication exactly as prescribed, even if you start to feel better. Stopping early could allow the infection to return. After the treatment, your doctor will likely retest you to make sure the bacteria are gone for good. Remember those red flag symptoms we discussed? These are non-negotiable and require immediate medical attention. Vomiting blood or what looks like coffee grounds, black and tarry stools, sudden, severe, unrelenting abdominal pain. You need to go to an emergency room. These are signs of a serious complication, such as heavy bleeding or a perforation, that cannot wait for a scheduled appointment. We have covered a lot of ground, but the path to preventing ulcers is built on simple, repeatable actions. It all comes down to a few core pillars of health that support not just your stomach, but your entire well-being. Let's restate the simple steps. First, be incredibly mindful of how you use pain medicines, especially NSAIDs. Use them only when necessary, at the lowest dose, and always with food. Second, embrace the power of clean hands, safe food preparation to protect yourself from H. pylori. These small daily rituals are your shield against infection. Third, fill your plate with foods that nourish and protect your gut. Plenty of fiber from fruits and vegetables, probiotics from fermented foods. These lifestyle pillars are your foundation. Quitting smoking. Limiting your alcohol intake. These are not just suggestions. They are transformative actions that reduce acid, promote healing, and protect your stomach lining. And do not forget the power of managing your stress. A simple 10-minute walk, a few moments of quiet breathing, a chat with a loved one can calm your entire system, which has a wonderfully positive effect on your digestion. Your body and mind are connected, and caring for one helps the other. This is your call to action, and it can start today, right now. You do not need to overhaul your entire life overnight. Choose one small thing, just one. Perhaps this week, you will focus on adding a serving of high-fiber vegetables to your dinner each night. Or maybe you will make a conscious effort to wash your hands before every single meal. Start small, build consistency. Let that success empower you to add another healthy habit next week. This is how lasting change is made, not through grand, overwhelming gestures, but through small, steady steps in the right direction. Your gut health is a precious asset, and you have the power to protect it. By acting on these simple principles, you can significantly lower your risk of ulcers and build a future with greater comfort and vitality. Listen to your body, honor its signals, and partner with your doctor when you need guidance. Remember the red flags and do not hesitate to seek help if they appear. You are in the driver's seat of your health journey. Take these simple steps, and you can look forward to a healthier you, a stronger you, a more resilient you. Your stomach will be grateful for a lifetime.